Hi, I'm Robin Henderson. I'll be discussing assignment 5 for marriage and family therapy. The first thing I'll be discussing is the the commonly used in outpatient care to eliminate the suspect conditions or diseases. While the term word well as clinical and support medical legal requirements, it wreaks havoc on radiology codes and radiology reimbursement. It is primarily true in the patient setting where ruled-out codes are not accepted as a primary diagnosis by most payers. Orders can also work with the physician's alias to educate radiologists about ruled-out diagnosis. Most radiologists are not aware of reimbursement problems associated with these diagnoses, and as a result, codes are forced to use non-specific codes. Many organizations have addressed these problems through clinical documentation improvement (CDI) terms. If your organization has a CDI term in place, step in and get radiology documentation on the agenda. The new Association for Clinical Documentation Improvement specialized have been created to improve CDI programs and codes, along with nursing and other healthcare workers are joined to the organization ranks. Some coding agencies or consulting companies provide CID support and education, and as an example, health records services conduct assessments. Its coding experts review current cases and codes that were selected. From there, the companies provide specific suggestions back to codes, radiology and administrators, and radiologists regarding clinical documentation, improving them both for reimbursement and compliance. Coding and radiology management can work in the outpatient register staff to reduce the amount of rules out examines, training your registers to look for appropriate reasons for an examination, and one that report showing real life examples or rules out examination do not meet medical necessarily because of incomplete clinical documentation. Also demonstrate the negative impact of reimbursement. The next subject is to discuss is psychological treatment. The treatment is an interactive process between the client and the psychotherapist. Treatment usually pays quite a bit of attention to unconscious motivation that can rely heavily on dreams interpretation. Treatment can also include such things as identity, unconscious connection with childhood emotional wounds, identity, unconscious emotion with dysfunctional behavior, recognizing emotional hurt, identifying dysfunctional thoughts paths, especially those that begins in childhood, the functioning through patterns, teaching relaxation techniques, stress management, and anger management, and generally support the encouragement. Treatment can also such as can be range from 1 to 12 sessions, brief psychotherapy to about 20 sessions, and identify a brief psychotherapy to several years. There are no original concept beliefs there are, so it is a good idea to discuss treatment length with your psychotherapist. The next discussion will be on family-based treatment. Family-based treatment is on the belief that the family is a unique social system which its own structure and patterns of communication. These patterns are identified by many things, including the patterns, belief, and value and personality of all the family members, and it includes the influence of external family, grandparents, aunts, uncles, cousins. As a result of the verification, each family develops its own unique personality, which is powerful and affects all its members. Family therapy is based on the following concepts as well. Illness in the family members may be symptoms of large family problems. To treat all the members who is identified as ill as treating the symptoms of the disease but not the disease itself. It is a probability that if the person with the illness is treated but the family is not, another member of the family will become ill. This is a cycle which continues until the problem is examined and treated. Any changes in the member of the family affects both the family structure and each member individually. Health professionals who use the family system model in the caring for people always consider the whole family. They view any people in the members, any one member of the system of the change or conflict in the group. A family therapist teaches many families about how families function in general and in particular in how their own functions. Helps the family focus less on the member who has been identified as ill and focus on more family as a whole. People identify conflicts, anxiety, and help the family development strategies to solve them. Scripts all family members so they can work on their problem together, teaching ways to handle conflict and changes within the family differently. Sometimes the ways the family member handle problems makes them more likely to develop symptoms. During therapy sessions, the family scripts are used to help them handle their problems. All members take responsibility for problems. Some family members may need to change their behavior more than others. Family therapists are a very active type of therapy. The family members are often given assignments. For example, parents may ask to be deleted. The next topic is discussed biomedical treatment. Therapy focus on treating the working the brain. It falls under the branch of mental health, which is an often symptomatic topic. Biological therapy are meant to help people with psychological symptoms and psychological disorders by using drugs, elected treatment, and psychotherapy, surgery. Let's look at it closer to 3 interventions. Drugs treatment is used in medical to treat medical disorders and known as psychomelotherapy. This therapy drugs are used for a range of psychological issues and can be grouped into categories. Medical is meant to treat depression, alter moods, and called antidepressant drugs. People who use antidepressants are more than just sad. Their medication and prescription to their doctor treat clinical depression and mood disorder characterized by feeling extreme hopelessness and lack of interest in life. Antidepressants also includes drugs such as Zoloft or Prozac. Medication used to relieve anxiety are called anti-anxiety drugs. Anxiety is a condition characterized by chronic worry, unease, and nervousness. Many feel anxious before a test or major life event, or maybe even experience extreme anxiety long periods. Doctors prescribe anti-drugs such as Valium and Xanax. Medications up to treat large psychological issues like schizophrenia and panic disorders are called antitoxic drugs. Patients who with these mental disorders can suffer from delusions, confusion, hallucination, and other extreme conditions. Antipsychotic drugs include Haldol and Zazabine. Electroconvulsion therapy. A second type of biotherapy is electroconvulsion therapy, better known as electric shock therapy. This is from use of doctors in the 1930s to treat depression, anxiety, schizophrenia by altering brain waves. Electrotherapy developed a shock in the patient's brain through electric placed on the temporal lobe. After the shock is developed, the patient has a confusion, a brief seizure, and become unconscious. These are the topics for the assignment 5 for the week. Thank you.